Hi everybody, a warm welcome to you from the Luxmama Club and ParentPrep ASBL. This is our very first video in the series we're creating for our awareness campaign, Have a Choice to Have a Doula. Who is the Luxmama Club? The Luxmama Club is a non-profit organization raising awareness for green, natural and holistic parenting alternatives, birth rights and perinatal mood disorders. How we do that is by providing social events to expecting and new parents for peer-to-peer support, and we also offer a range of parent prep activities, weekly classes, workshops, and pre- and postnatal discussion groups. You'll also find our community grouped on Facebook and Meetup. And at the moment, we're working on our first awareness pillar, birth rights, or better explained as human rights in childbirth. And as part of that, we have launched our campaign, Have a Choice to Have a Doula, with the aim of raising awareness at the level of consumers and care providers on the use of doula support during labor for the birthing couple, both on the proven benefits we see as well as parents' rights in obtaining the support. Now, continuous professional labor support by a person independent from the hospital setting, independent from family or friends, has been studied more than any other birth intervention currently used in hospitals and is gaining ground globally due to not only the improved birth outcomes we see, but also the overall satisfaction of families birthing their babies in any birth setting or any mode of birth. But here in Luxembourg, it's still quite unknown among consumers as well as care providers, especially in hospital settings. And we would like to peacefully shed light on that with our campaign. Myself personally, I'm a holistic maternity and sleep coach working with expecting couples from the beginning of pregnancy, providing them with unbiased information, education and support in helping them to navigate this whole transition into parenthood. I had 2 babies here in Luxembourg, my first in 2011 and my second in 2013, which led me to a big career change and starting my studies as maternity coach. And then I came across birth doulas in my certification, which was quite a surprise as I never came across the concept while having both my babies here in Luxembourg. So I was trained in my studies how to assist expecting couples in choosing the best care providers for them, which can be an obstetrician, a midwife, and birth doulas as well. And I was really astonished at the benefits, first of all, and then also after doing research in my own community and experience with my own clients, I was really surprised about the lack of awareness about birth doulas. And then the few clients that was actually aware of it, I was genuinely surprised about the barriers parents may face when they try to hire a birth doula. And so at that stage, around 2014, the seeds of this campaign was already planted. And I started doing more and more research, and then beginning 2016, a birth doula and childbirth educator from Canada, soon to move to Luxembourg, contacted us out of the blue. And to us, this was the final sign that we absolutely had to do this awareness campaign in Luxembourg. Erin joined our team as volunteer and teacher, and she is here with me today to tell you more about birth doulas. So Erin, thanks for being here today. Can you please tell our viewers, I'm sure they would love to find out, what exactly is a birth doula and what kind of services do they provide?
Well, thank you so much, Maurice, for having me. I'm excited to talk about doulas. It's what I love, and it's a great thing to have as an option for expectant parents here in Luxembourg. So I'm really happy to be involved with the Luxmama Club. Basically, what a birth doula is unmedical, so no medical role, external, not involved in the hospital in any way, professional, continuous support during labor. So birth doulas offer resources and education in the prenatal period, as well as provide emotional, physical support and comfort measures during the birth, and advocacy for your birth choices. So whatever your choices might be, a doula will be there to, help offer advice for sticking to the plan and be there for you, 100% focused on you as your continuous support. So in Luxembourg, postpartum and postnatal visits and appointments are conducted by the sage-femme libérale in the home. They come to your home after for the postnatal care. So that's great. So today, I guess we're specifically talking about birth doulas.
Exactly. And so sage-femme libérale, just to clarify there for the non-French speakers, they are the independent midwives here in Luxembourg, right?
Yes.
So tell us, Erin, how did you become a doula, and can anybody become a doula?
Well, for me, I really felt like becoming a birth doula was my calling. I had done other careers. I had been involved in several other kind of career paths, and I had always had an interest in childbirth. And it was actually after my aunt had a home birth that I was really like, wow, this is an amazing option. And there are so many choices women actually have during birth. So for me, it was definitely a calling, something I've always been interested in. And not only that, to be honest, birth doulas have been around since the beginning of time. Women have always been supported by women during childbirth. You can see this in history and in reading and any kind of literature. You see the role of a birth doula without it actually being titled as a doula. So that was really interesting to me as someone also that has studied history. But basically, I did my certification through a Canadian organization. The certification process takes about 2 years, and it's an independent study, so I could focus on specific things that were of interest to me while completing the certain requirements for reading, assignments, and practical components. So certified doulas are trained through various organizations, like the one I did, as well as several larger ones from the United States, specifically Doulas of North America. That's one of the most famous and well-known training organizations for doulas. But they exist all over the world. I think regarding Europe and close to here in Luxembourg, the closest ones are in Belgium. But basically, anyone can enroll in this type of program, but like anything else, any other career path, you require a certain certification, certain training to be certified.
Okay, and how would a doula make the birthing process more comfortable for the laboring women as well as those around her?
Well, basically, as a birth doula, I meet with clients before the baby is born, before the big day, and I build a rapport with them. I meet with both the birthing mother and her partner, in their home usually, so it's comfortable in a nice setting, and we talk about everything to do with their choices regarding childbirth, their wishes, their fears, the things they absolutely are okay with, the things that they aren't. And basically, having built that rapport, when the big day comes, I'm aware of what their wishes are, and I'm able to, provide advocacy for those choices. And in that, I support the partner as well. So as while I'm focusing on, the birthing woman, to me, it's really important that the partner is also involved to their comfort level. So by encouraging use of comfort measures, by, giving guidance as to ways that the partner can help and support the laboring mother, that's really important because it brings them together as a couple. Basically, through providing comfort measures, advocacy and support, and having that personal rapport, it makes the birthing experience better for the couple in that regard. Because in the hospitals, you don't know who you're going to have regarding midwives because they're on shifts. So having the doula there is someone that you know and someone that's been by your side throughout, part of your pregnancy, even the whole thing, depending on when they contact me. So that's, I'd say, how I can really, make the most of the experience for both parents.
Okay, and each birth is really individual. So the type of comfort measures you would use and help and guide, the way you would guide them would really be individualized to each couple.
Absolutely, yeah. So in the prenatal visits that I have with clients, I, talk to them about things that are comfortable for them, ways they might already cope with pain, things that we don't think of, like, for example, what happens when you stub your toe? The way you deal with that kind of pain can also be an indicator of how you might be able to deal with pain in labor, and that differs from woman to woman. So
Yes.
absolutely, it's super unique.
Exactly. That's very interesting.
Mm-hmm.
And what is the difference between the role of a birth doula and a midwife? Because many people I speak to normally would say, but isn't that the role of the midwife?
Mm-hmm. Well, that's a question I get a lot as well. When I explain what I do, people are like, oh, so you're a midwife? And I say, no, absolutely not. My role is very different. We're both care providers, and we offer families education, support, and compassionate care. But we have very different roles, but we both work for the families, which is really important to remember. A doula offers emotional and physical support during pregnancy, birth, and a little bit postpartum, whereas a midwife will offer clinical support and care for healthy pregnancies and to examine and diagnose and treat things medically, whereas a doula has no medical role. So even, to the simple effect of taking blood pressure, that's not something I would do. That's beyond my scope of practice. So I have no medical training, and I don't claim to, do anything. I always suggest clients go see medical professionals if they have medical concerns, which is where the midwives and the doctors come in handy. The doula's primary role is simply to be there for you and your baby during your pregnancy. And midwives offer preventative care and the promotion of normal birth and care plans for complications for both the mother and the child. And they assess medical and emergency care needs. So they're very important. The midwives are your medical component of birth, as well as the doctor. And that's the main difference, I'd have to say. They're very complementary roles. Doulas and midwives work quite well together from my experience, mostly in Canada. But unfortunately, in most medical scenarios, the midwives are very busy, so they can't, even if they would love to, they can't offer the kind of support that a doula can in terms of continuity and continuous support throughout the whole labor based on their requirements as medical professionals. So that's why doulas and midwives really make a great team for birthing parents.
That's amazing. And so what is your favorite part of being a doula?
Oh gosh, there are so many amazing things. It's really a rewarding and career of passion, as I mentioned. And to be honest, I believe in women and I believe in birth. So for me, to be able to witness such strength in women, and for partners providing so much love and compassion to their partners, amazing. It's really a privilege to be invited to and to witness this life-changing and huge event in people's lives. So it's not something I take lightly. Every time I'm invited into a birth, I'm truly and honorably, or totally honored, really. It's very special work, and just seeing families grow is super wonderful and lovely. You get all the feels.
That's amazing.
Yeah.
So why would having a doula, a birth doula, be better, or why do we see better outcomes from birthing couples that had a doula as opposed to just a close family member or a friend as the birth coach?
Mm-hmm. Well, I mentioned earlier, it is a passion, and it's something that you kind of fill your life with if it's your calling. So my knowledge set is always changing and always developing. It's lifelong learning for doulas, based on best practice care, the latest with regards to interventions and comfort in labor. There are always things developing in this regard in childbirth. So having someone that's 100% devoted to learning about these kind of changes in best practice maternity care is definitely to your advantage as a birthing woman. Of course, you might feel very supported and very, comfortable with a friend or a family member you've invited to attend your birth. And you know what? For a lot of people, that's wonderful and it works. But having a doula who has a specific knowledge set and is trained in various types of birth, and if they're like me, has attended lots of different kinds of birth, can be beneficial. A doula, while we are emotionally invested because of it's a profound experience to be invited to a birth, but despite this, we are able to remain, I guess, unemotional, if that makes sense.
Yes.
When you see your best friend or your daughter or your cousin, whatever relation you have with this person, if you see them in kind of a vulnerable state and they're feeling pain, they're uncomfortable, it's easy to get emotionally tied up in that. And as a doula, we're able to kind of remove that component and focus solely on the birth, their wishes, and reminding them, when things get difficult, of their choices they've already made. And that's why having someone professional might be better than your closest friend or your cousin, your sister, whoever. And it's mainly because of the knowledge set, I'd have to say.
Okay. And it's a major emotional event. And so I can imagine how those around you can influence you. And if you have someone that is more grounded and that is experienced with this type of such emotional and loaded situation, it's just it's a bigger support.
Absolutely. And I'd have to say, you saying a loaded situation is a good way to describe it. It's not super descriptive, but it's just
a big moment. It's huge.
It's a good thing. And not only that, it's, there are so many components that are making up this environment that you're creating and that you have in your birthing experience. So absolutely.
So can doulas be present for all types of births, or is this just for natural birth if you want a natural birth?
No, I think doulas can be beneficial at all types of birth, whether it's, a home water birth or, even a cesarean birth in the hospital. Personally, I've attended all types of birth, and it doesn't matter. A doula is able to, as long as basically, and you talk about it a little bit with regard to choice, if your choices are respected and you are feeling secure in the decisions you're making regarding your care, a doula can only promote positive feelings. There's nothing bad to say about having extra support in your labor, regardless of what kind of labor you might have.
Exactly. It's more than just about the physical know-how that you bring to the table, but it's also the stability and the feeling of being grounded through this big moment. It's a big change that the birthing couple is having in one day, one or 2 days sometimes. And it's just such a big moment. And if there's someone else holding space and just grounding them and remembering them, reminding them what's important, this really makes what we can see, and we will talk a bit now about the evidence we see, the satisfaction is higher. So we know that doulas, the use of birth doulas, that it's evidence-based. And we're going to look at the benefits that's documented from a couple of large-scale studies. And I'm going to share my screen for this. And what's also important to realize is that the World Health Organization has said that all women worldwide should have access to doula support during labor. Also, the International Mother-Baby Childbirth Initiative have actually recommended that care providers inform expecting parents of the benefits of having a birth doula. Furthermore, the Mother Baby Friendly Initiative by UNICEF and the World Health Organization includes the requirement to encourage mothers to be continuously supported physically and emotionally by persons of their choice. So not just the partner, but additional persons that they may need. So it is becoming more common globally, and the evidence is well documented. Here you can see a conceptual model for continuous labor support. Now this comes from evidencebasedbirth.com, which is a highly reputable source that we always refer expecting parents to. Their goal is to put evidence-based information into the hands of communities so they can make empowered choices. And feeling empowered in our choices comes from informed decision making. So this is knowing the latest evidence, discussing that with your care provider, and then bringing in your own values, goals, and preferences, because we are all different and we will have different birth preferences. This is great because for decades, the vast majority of birth research evidence has been locked away in medical journals. That luckily has changed now, and we want to encourage parents to make use of these non-biased sources with the most current evidence-based information on pregnancy and childbirth. So in this conceptual model, you can see that when a birthing person is provided by continuous labor support, it increases the oxytocin, the love hormone release, the mobility of the birthing person, as well as the self-esteem, and also it decreases the pain level the person is experiencing, because doulas are in itself a form of pain relief on its own. It also decreases the level of anxiety, which in turn affects the experience of pain in the body as well. Now, then we also see this all results in the decreased use of epidurals because there's less of a need. There's also then resulting in a shorter labor, and therefore less medical interventions are required, which finally brings higher satisfaction, increased chances for a spontaneous vaginal birth without extra drugs, and then decreased C-section rates and better infant outcomes, because mom is doing better, so baby will also do better. So you'll also see here a little summary on what the evidence is saying. In research studies, the best results happen when women have continuous labor support from a doula. Now, this is someone who is not a staff member at the hospital and not part of the women's social network. The reason for that is when the person is a staff member at the hospital, they have lots of other responsibilities and they cannot exclusively focus on the birthing person like they would maybe wish to do. And not part of the women's social network, the reason for this is that the doula can be emotionally objective and provide a better emotional support than someone that knows you dearly and that may not be emotionally stable when you are at your most vulnerable. Now, when you have continuous labor support, you and your baby are more likely to have better outcomes. So what are these outcomes we're referring to? First of all, a 31% decrease in the use of artificial oxytocin to kickstart or speed up labor. This is huge because the famous obstetrician Michel Audin explains to us that we really don't have any evidence on what the long-term outcomes are from the use of this widely used drug. And also when it's introduced, that stops the production of mom's own oxytocin, which influences her own symphony of hormones that Mother Nature designed for birth. Next, we see a 28% drop in the risk of a C-section. So that's not to say that everybody wants to avoid a C-section. For some it may be a choice, but for many they aim for a vaginal birth, but for various reasons it may end up in a C-section or cesarean birth, surgical birth. And the good thing here is that we know having a doula support the couple can decrease their risk of having a C-section by 28%. Now, we do know there's a reason why many parents are trying their best to maximize their chances of not having their babies born by C-section, because it can impact the baby's long-term health. And there's been a lot of new research coming out that you can check out on microbirth.com for further information on the research of the microbiome, the seeding of baby's immune system, which is affected by the mode of birth. And of course, then there's also many other risks or implications attached to having major surgery, especially for subsequent pregnancy. So do check that out if you are thinking about this. Then we also see a 12% increase in the likelihood of a spontaneous vaginal birth and a 9% decrease in the use of medication, because the doula is a form of pain relief on its own, remember? Then a 14% decrease in the risk of newborn being admitted to the neonatal intensive care unit or special care nursery, NICU. Wow, so now we're not only talking about what happens with the birthing woman, but also her baby, because remember, the mother-baby dyad we can see as one unit, as their well-being and experiences are so interwoven. Lastly, a big one here, 34% decrease in the risk of being dissatisfied with the birth experience. Now, this is huge. The reason why it's so important is that the birth experience has a profound impact on the mental health of the birthing woman, which in turn influences her parenting, her relationship with her baby, other siblings, her partner, society at large. And if mom is having a tough time, most likely baby is receiving some form of imprint in the nervous system and the limbic brain or emotional brain during this crucial time, which could impact in future how baby reacts to stress, as well as impact future relationships. So this one is really a biggie, and we need to pay more attention to families' emotional experiences of birth. So doulas provide emotional support, which also helps the birthing person. This also ties into another aspect, which is the attachment between the birthing person and the doula, which can lead to an increase in oxytocin because they got to know each other before the big day, and in fact the doula was handpicked by the couple. And so oxytocin is the hormone that promotes labor contractions, and this theory was proposed by Dr. Amy Gilliland in a 2010 study about effective labor support. She explains that the doula effect is related to attachment. When the mother feels vulnerable in labor, she directs attachment behaviors to suitable figures around her, who may or may not be her attachment figures, a parent or a friend. When the mother directs attachment-seeking behaviors to the doula, however, the experienced doula responds in a unique manner. She's able to respond as a secure base, thereby soothing the mother's attachment system. And the accompanying diminishment in stress hormones in turn allows for a surge in oxytocin in both the mother and the doula. So theoretically, oxytocin is the hormone of attachment, and it's released during soothing touch and extended eye contact, which are habitual behaviors of birth doulas. Another Swedish oxytocin researcher, Kristen Uvnas Moberg, writes that the doula enhances oxytocin release, which decreases stress reactions, fear, and anxiety, and increases contraction strength and effectiveness. In addition, the calming effect of the doula's presence increases the mother's own natural pain coping hormones, her beta endorphins, making labor just feel less painful. So now one of the very common questions are, why do we need a doula if there is a midwife or labor and delivery nurse? So midwives or nurses provide support when they can, but research has shown that they can only spend a limited amount of time in each client's room, unfortunately. So in a study, Barnett et al. 2008, nurses went about 31% of a person's labor in the room with them. Most of the time when they were in the room, they were doing direct clinical care, like, for instance, giving medications, performing interventions, maintaining equipment, using the electronic fetal monitor, documenting at the computer. And then for 12% of the person's labor, the nurse gave labor support, which included emotional, physical, informational support, etc. Now, 3 other studies found similar findings. Nurses spent 50 to 75% of their time outside the birthing person's room. And in addition to caring for their assigned client, they have many other responsibilities like communicating with care providers, caring for other clients, covering other nurses' breaks, documenting care, etc. So you can see that in a hospital setting, they are not exclusive to one couple at a time, like a doula will be, and they will also change shifts. So the support is not continuously there. Also, here in Luxembourg, you cannot choose your midwife in birth if you are giving birth in a hospital, so she may not resonate with you, which can greatly impact your labor progression and emotional experience. Now, actually, since the beginning of time, women have been accompanying women emotionally through birth, so the concept of doula support is definitely not new, and any person that you will feel safe and connected with can actually assist you. But we do see from the studies, if this person is also professionally trained and knowledgeable in birth, like a doula, or even a midwife acting in the role or capacity of a doula, brings about more benefits because they have more experience in the field. Makes sense. So, in having said all that, Erin, what would you say are the reasons why these improved outcomes and statistics are observed?
Well, you said it all pretty well. All those things, advocating for your choices and remembering your choices when things are a bit more emotional. The doula is there to gently remind you if there's a diversion from your chosen birth plan. But I have to say that I think mostly it's because of that rapport. We get to know our clients quite well. I feel I'm still in touch with several of my, clients, and it's because of the special relationship we formed. But like you said as well, knowledge of the process, trusting birth and trusting, natural oxytocin. It's the love hormone. We feel it not only in birth, we feel it in all aspects of our life where we're feeling loved. So that can be a gentle touch from an important or special person. That can be, the moment you're leaving the airport and you see your family waiting for you, you get a rush of this oxytocin. It can be in so many different areas of our life, but encouraging the promotion of that through, nice dim lighting, having comforting massage, music that you like, suggesting various things that you can do other than kind of just lie in bed and wait for things to happen. There are so many things that a doula keeps in her little bag of tricks, let's say, that can help to speed up labor, which is why we see the statistic on labor being shorter, because doulas know that if you do this, this is going to happen. Chain reaction. And of course, birth is individual. Every woman has a different birth, even from one child to the next with the same mom. Birth could be totally different. But typically, if you use gravity in your favor, if you have things that promote this oxytocin flowing, and if you're able to get up and move around, then with the support of your doula and your partner, all those statistics are likely to happen just because of you're taking control of the process rather than letting various medical interventions kind of help the process along. The body is an amazing thing. And having witnessed so many births myself, I I can say, and not only natural births, I'm talking about all kinds of births. You know, having witnessed that birth is in the body, and the woman's innate ability to give birth is absolutely amazing. So, you know, having your doula there for all the reasons you stated, Maurice, as well as, you know, suggesting position changes and all the things that I just mentioned, that's certainly, you know, on the right path to making the birth more enjoyable for everyone involved.
Because birth can be enjoyable.
Absolutely. Yeah,
And
it should be. It's, I mean, not to say you're going to love every minute of it and everything that you're feeling. Of course, there are things that cause discomfort, but it's a wonderful and magical, for lack of a better way to say it, thing. And it's something that if you accept and you relax, you might be able to enjoy.
exactly. And I always love thinking about doulas, how doulas are mothering the mother, but it's not just the mother, it's also mothering the father.
Yes, absolutely. There have been situations where I've had to, mom was doing fine, dad not so much. I've had to remind dad, like, this is what's happening. You need to breathe and you know, ground yourself, because you're essentially the rock for both of them. So it's definitely mothering the mother and mothering the partner.
Exactly. So doulas are not commonly used in Luxembourg yet, as it's still unknown. And plus, when families request it, some care providers say that only one person can be allowed in the delivery room. Now, we have spoken to legal experts and we looked at what the law says, and there's actually nothing in the law that says you are not allowed to have doula support during labor. And in fact, Article 8 of the EU Convention on Human Rights states that everyone has the right to respect for his private and family life. And through court cases, it was observed that the right to privacy explicitly includes the right to choose the circumstances of childbirth, which means having the right to choose your birth companions. So our advice when a care provider says no, or a care provider is reluctant about the use of a birth doula, they may still be unaware of the benefits. So what we would suggest is inform them respectfully. Always handle this conversation very respectfully. Inform them of the benefits. Take a look at our website, luxmamaclub.com. Also take a look at evidencebasedbirth.com and take along some information to your care provider for this discussion. So inform them of the benefits, and then secondly also of your human rights to respect for private and family life. And remember also that it's always possible, it's never too late to switch care provider, because there are care providers that are already on board and that understand that they want more clients with positive birth experiences. There's nothing not to like about that. And then remember, moms and dads, as uncomfortable as this conversation may be, having this discussion and respectfully addressing it and standing up for your rights and for your baby's rights will open doors for future families. And it will help you to practice your muscles in standing up for your future child in different walks of life, which you will definitely later do a lot later on. So, Erin, how would you suggest families go about this touchy discussion? And have you had similar experiences with care providers in Canada?
It's a difficult one to address when, you know, it's a matter of, in a question of whether the caretakers fully understand the benefits and the impact that this has on the clients, and ultimately, you know, the end result of, you know, having happy and healthy families. I think doulas and doctors really have the same goals, and we all want the families to be happy. We all want women to feel satisfied and empowered by their birth experience. So I think it's really just a question of caretakers not yet realizing these benefits. So I think you know, in regards to going about this decision, like you said, Maurice, it's a matter of having these respectful conversations, understanding that, you know, maybe most evidence-based and best practice maternity care hasn't yet made it to the care center that you are seeing, your hospital. So I think preparing for these meetings and having these discussions is really important, and coming with evidence, you know, have the information there, have that evidence-based birth sheet, you know, have time, and make sure that you're asking questions and, you know, providing the information about things that matter to you. And if having the extra support, you know, is very important to you, which, you know, as we've talked about all the statistics, the World Health Organization, everything touting the benefits of doulas, it's something that should be an option, a viable option for all these expectant parents. So, you know, I think it's just a matter of informing respectfully, as you said, and coming with evidence and being prepared to advocate for your choice. Regarding me having experiences in Canada, you know, Canada healthcare is wonderful, and not that it's not here, it's just especially in Canada, it's known for having wonderful healthcare. And, you know, some doctors, they're still not 100% comfortable with the idea of doulas, but they understand the benefits. So in a way that they might wonder why you're there when there are nurses and they're also there. You know, that happens sometimes, but predominantly I think care providers really do see the benefit and encourage doula support. I haven't encountered any trouble with attending births. You know, it's a matter of your personal choices and your wishes for your own childbirth, and this can be under your right to privacy regarding that EU convention, or it could just be, you know, for compassionate sake. You know, when you're going through this life-changing event, you want it to be as positive and wonderful as you can be, and with so much evidence behind doulas and the kind of support doulas are able to offer, there should be no question about whether or not it's accepted in the hospitals. So
exactly. So Erin, lastly, let's imagine all the babies of the current and future expecting families in Luxembourg. Let's imagine they all have a collective voice and they are here with us now. What would they have to say about this?
The babies.
The babies, yes.
Well, like I said earlier, my own beliefs, I really believe in women and I believe in birth. And I think babies do too. I think that babies know how to be born and they trust their mums to, you know, bring them into this world in the best way possible. So, you know, if the babies could have a voice and could make their opinion known, I think they would say, trust the process. You know, help my mom, help her, you know, have a most comfortable experience, because it's going to directly affect that baby. So they obviously want their mom to be happy and healthy, which in turn makes them happy and healthy. So I think they'd probably say, help my mom have her wonderful birth experience, let her have her doula there, let my dad be there too, and let's all be happy and happy and comfortable. I think that's probably what they say. Obviously, I'm not sure, but I think that's, you know, I think it's a fair thing to say.
Exactly. That's beautiful. Thanks, Erin. Thank you so much, everybody, for staying with us. And for more information, visit our website, www.luxmamaclub.com. Keep an eye out for future interviews that we are planning. And if you had a doula and you would like to share your story, please contact us. And if you are interested in having a birth doula and you are unsure of how to start the conversation and you would like some help, please contact us. We'd also like to hear from you. We are there for you and we want to open doors for future parents after you. So thank you so much for watching and have a beautiful day.